The Covid-19 Antigen Rapid Test device is an in vitro diagnostics based on the principle of immune chromatography for the qualitative detection of SARS-CoV-2 nucleocapsid protein antigens in nasal swab and nasopharyngeal swab. The kit includes sterilized swabs, extraction tubes with 0.5 ml extraction buffer, nozzles with filter, tube stand, Covid-19 antigen test device, package insert, Covid-19 antigen positive control swab, Covid-19 antigen negative control swab. Allow the Covid-19 antigen rapid test device and collected samples to equilibrate to room temperature 15 to 30 degrees centigrade prior to testing. Check the expiry date printed on the kit. Do not use kit components beyond the expiry. Prepare test samples with extraction buffer and sterilized swab for immediate testing after collection. Insert nasal swab into one nostril, and the tip should be inserted up to 2.5 cm from the edge of the nostril. Gently rotate the swab 5 times or more against the nasal wall for collecting cells and mucus. Insert sterilized swab into nostril parallel to the palate and leave in place for a few seconds to absorb secretions. Collect samples with nasopharyngeal swabs for optimum results. Open the lid. Insert swab with collected sample into extraction tube containing 0.5 ml of sample extraction buffer. Insert swab with collected sample into extraction tube. Squeeze the swab several times by compressing the outside walls of the tube end against the swab to mix well. Finally, squeeze the swab to make most of the solution stays in the extraction tube and remove the swab. Use extraction solution as test sample. If immediate testing is not possible, collected samples can be held refrigerated for up to 48 hours prior to testing. Remove test device from sealed foil pouch just prior to testing and lay flat on workbench. Insert filtered nozzle into extraction tube containing test sample. Invert extraction tube and add 3 drops of test sample into sample well by gently squeezing extraction tube. Read the results at 15 minutes and disregard after 30 minutes. A positive result may be visible at 3 minutes. However, the complete reaction time of 15 minutes is required to confirm a negative result. Positive result. 2 red lines appear. 1 red line appears in the control region C and 1 red line in the test region T. This indicates that the specimen contains detectable amount of SARS-CoV-2 antigen. The shade of color may vary, but it should be considered positive whenever there is even a faint negative result. Only 1 reddish band appears on control region of the device. No reddish line is visible next to the test T. This indicates that there is no detectable SARS-CoV-2 antigen in the sample. Invalid result. No red line appears in the control region C. The test is invalid even if there's a line in the region T. Review testing procedures and repeat the test using a new rapid test device.